Most oral health problems, one way or another, can be traced back to either secrets, silences, or suppressed emotions. Because my theory is that when we aren't able to express whatever we need to express, then the energy gets stuck in our mouth. This is the primary organ of expression. If we're not able to express ourselves, then that energy is stuck behind this doorway. And what does it do? It builds up. It causes imbalance.
Today, I had the pleasure of speaking with Meliors Simms, the author of The Secret Lives of Teeth and someone who's been dubbed the holistic tooth fairy. In this conversation, we dive really deep into the many years of work she has spent dealing with teeth, the mouth, and our dental care. Today, we talk about the tooth archetypes that Meliors has developed through her years of speaking with clients and understanding the emotional, energetic, and metaphysical links that our teeth have to the rest of our body. We also talk about traditional Chinese medicine and its meridians and how that system is linked to the tooth archetypes that she has developed. And she's meshed these things together so that she has a more complete and holistic view of the energetic effect of teeth on the rest of the body and is able to explain this to her clients. And in doing so, has helped thousands of people all over the world deal with dental disease, dental trauma, dental fear and anxiety, and is in her own very unique and powerful way transforming the paradigms of dentistry one holistic consult at a time. I know that throughout this conversation, you will hear something that shifts the way you see teeth and perhaps allows you to better understand their secret lives. Meliors Simms, I am so excited to have you here today to discuss your work with teeth and the knowledge you've gained about the secret lives of teeth. Now, that's the book that you've written, and you have some metaphysical gems scattered throughout the book. And what I would really love to do today is to talk about your experience within the dental world, your experience you've had working now with many, many clients over the years, and how you gained insights into mapping out the teeth and their relationship to the emotions and the energetic realms of our bodies and our existence.
Thank you. It's a great honor to be here speaking with you and your audience, Nirvani. My origin story, I guess, is that I had terrible teeth for most of my adult life, and I spent a lot of time in the dental chair, spent a lot of money, had a lot of pain and grief and frustration, and I was doing everything I was told. I was really trying very hard to take care of my teeth, and people used to tease me about how vigilant I was about flossing, and I tried to eat really healthy, and I was really regular at the dentist, and yet every time I went, there was always something wrong. I was always getting fillings, root canals, crowns, just everything. It was so frustrating. And then I kind of reached a point where I was having panic attacks because I was having so much trauma in the dental chair. And I was sort of on the verge of what would have been my 7th root canal and my second one within 18 months. And I just came home from that appointment where they'd given me the antibiotics and said, come back in 2 weeks for the root canal. And I just thought there's got to be something else than just following dental advice, because the dental advice is not working. And that kind of flipped a switch where I started thinking about my teeth and my oral health for the first time in the way that I thought about the rest of my general health, which had always been a very holistic self-help kind of proactive approach. I was really into whole body health and diet and herbs and all of that, but I hadn't really applied that to my mouth. Well, I hadn't at all. The mouth kind of exists in a black box in our culture, like it's cut off from the rest of the body, like this separate entity. And so I started doing some research and very quickly found some nutritional information, started taking some supplements, made some changes to my diet, and it worked so well that I'd never had to have that root canal, that seventh root canal. I went back in 2 weeks and said it doesn't hurt anymore. And he had a look and he said, no, you don't need it. And good luck to you, sort of thing. And I thought, this is amazing. This is a miracle, what I can do. And I just started researching everything I could learn about alternative approaches to oral health and experimenting on myself and talking about it to anyone who would listen. And then after a few years of not needing any fillings or any other dental work done and people around me starting to be very interested, I decided to see if I could offer coaching. And so that's when I started working with other people. I set up my business as the Holistic Tooth Fairy, offering coaching online so I could work with people all over the world, because I'm in New Zealand, which is a very small country. There's not a lot of market for doing anything that's so niche as this is, and it's very niche. So I started working with other people, and that's when I really started to see the metaphysical side of things and observing how what was going on in people's lives was kind of embodying or reflecting the emotional problems they were having, the difficult life decisions that they were facing, the places where they've been stuck socially or professionally. And I've 9 years later, it's been thousands of people that I've talked to, and I've seen some patterns and themes emerge. And that's when the basis of what I now call a tooth archetype system came into being. And I decided to write a book because there was so little information about the metaphysics of oral health. It was almost impossible to find anything more than a few paragraphs here on the internet and a few paragraphs there, and books that weren't published in English. And I thought, well, there needs to be like some reliable reference, and I guess it's up to me to write it. So I wrote The Secret Lives of Teeth, Understanding Emotional Influences on Oral Health. And the heart of that book, which also describes all the existing frameworks that I've discovered, but the heart of the book is my own system of tooth archetypes.
Yeah, thank you for that explanation and a little bit of background about how you got here. And I will say, as somebody who's been in this field for a long time and read lots of books, including a lot of holistic dentistry books, I have never seen, never read, and never heard of a really consolidated way of describing the emotional link to teeth, and certainly never read or heard of tooth archetypes until I came across your book. And so it is, one, exciting, but two, also just a really fascinating collection of patterns that you've been able to draw from working with all of these people over the years. And if you wouldn't mind, could you go into what a tooth archetype is and how you managed to come up with these archetypes? What patterns have you been seeing across, your calls or your consultations with people that allowed you to sort of map these archetypes of our teeth out?
So a tooth archetype is a way to summarize the strengths and vulnerabilities, the themes, the associated relationships, the ancestral traumas, the questions that are being raised in your life that show up as symptoms. So when a tooth archetype, it's kind of like a job description. So every one of the 32 adult teeth has its own archetype, and you can think of it as a job description. But when the job gets filled, it's done by a unique individual who does the job in their own unique way. And so your tooth archetype for, say, your upper right second molar is going to express differently than my archetype in my upper right second molar. But there are some commonalities, these common themes, strengths and vulnerabilities. And that's what I was observing. So molars in general, I call the adulting teeth, because they tend to really be concerned with the challenges and opportunities that we face in our adult lives. Whereas the incisors, particularly the central incisors, are much more reflecting the experiences we had when we were infants and toddlers and small children, but also the patterns that we kind of learned in those early experiences, in those primary family relationships that still influence the way that we relate to people and operate in the world now. You know, you're in a child, you're in a 2-year-old. Well, that's living in one of these lower incisors.
Okay. Yeah, I definitely, even just from a clinical perspective, I still practice with patients. If I think about the ways where what you're describing will link to things that I've also noticed in practice, I can see where you can draw those conclusions from. When you're talking with people and you're doing, let's say, a consultation with somebody who's coming to you because they want to understand what's going on with their mouth and their teeth, what does that look like? What are some things that you're asking them or information that you're gathering to try and see where you can help them and how you can come up with a plan that they can follow to address their issues?
Yeah, I start by sort of mapping the mouth. So we're identifying which teeth have the cavities or the root canal or have been extracted and have the implant or are showing like deep gum pockets. Wherever the symptom is, we locate it in the mouth, because all the main systems that I know of and that I use and that inform the tooth archetype systems locate meaning according to where the problem shows up. So that's the first thing, is like, make sure we're talking about the tooth that actually has the problem. And, you know, sometimes even people getting clear about what's left and right is a challenge. So we do that. And then I will generally refer to the archetypes to ask a question. So someone may say, you know, I've got a real problem with my lower right first molar. And I'll say, what's been going on with your job? What was happening with you professionally when you first started noticing symptoms in that tooth? And so sometimes they have to think back 10 or 20 years to the first filling if they've now, you know, got a root canal or facing an extraction. It can, you know, there can be a long history of problems. What were the career challenges that created the context for that tooth to first become vulnerable? And then we start exploring the way that those professional issues, because that tooth is the professional archetype, were playing out in their life at the time and that key points in that tooth's history. And very often there are parallels in that, you know, a key point, turning point in that tooth's history more or less aligns with some significant challenge for them professionally. And then we look at the relationships between that tooth and other teeth that have problems, because it's not very often you've got a single tooth showing symptoms in isolation when there's no other things going on in the mouth. And then we look at almost like a conversation between two or more archetypes and how they relate to each other, the influence of your family on your professional choices, or how the way that your job affects your marriage or your home life. Or, you know, so we use the map of the teeth to kind of guide a conversation about the reality of your life, and then can start to identify where it's like your psyche is using the symptoms to ask for attention, to ask for releasing pent up emotions, suppressed emotions, asking for you to make changes. And then we, you know, talk about how to address those needs. What do you need to express and release? What do you need to change? And that's where the coaching really comes in.
So a lot of what you do, you know, it sounds like initially it's some fact finding, you know, like in a very practical way. What's the issue? What tooth is the problem? What is the problem that's been diagnosed? And then from there, you start to address more of the emotional or environmental factors that could be leading to, some dysregulation within the energetic field of a person. Would that be a sort of a fair way to put it?
Yeah. One of the things I say is that most oral health problems, one way or another, can be traced back to either secrets, silences, or suppressed emotions. Because my theory is that when we aren't able to express whatever we need to express, then the energy gets stuck in our mouth. This is the primary organ of expression. If we're not able to express ourselves, then that energy is stuck behind this doorway. And what does it do? It builds up. It causes imbalance, dysregulation, as you say, and that can either quickly or slowly lead to physical symptoms as your body says, hey, you really need to do whatever needs to do to express and release this stuck energy.
Yeah, I have, my own thoughts on this and some of this comes from, I've studied German new medicine over the years a little bit. And, obviously I've been working with patients for a long time, but I agree. I think when you're not able to express yourself, when you're trapping things within your body, but particularly they get held in the mouth. And this is a place that it's so hard to ignore. We eat with our mouth, we speak with our mouth, we swallow with our mouth, we express ourselves, as you said, with our mouths. And so if something's going on in your mouth, you almost can't ignore it. And I think this is part of the divine design of our body, is that we are wired or we are divinely created to be signaled by something that is unmistakably giving you a message. And in this case, I think our mouths are the first place that we get that message. So when there's something that's off within the body, within your biofield, within your environment, and you're just really out of alignment in some way, your body has developed this system of alerting you, often through your mouth or through your teeth, that something's wrong. And because of how integrated our mouth is to these very practical things within our body, and then if you take it a step further, the alignment of your jaw affects the alignment of your posture overall. It affects your hips. It affects your ankles. All of these things are affected by your mouth. I think that is, it's part of the design of who we are as humans, that we get these alerts and they show up in the teeth. And you've happened to map them all out and create some languaging around it, which is, for somebody like myself, it's fascinating because what you've done is actually taken some of the principles that are in these other systems like German new medicine, even in, some Ayurvedic teachings, and, through the work that you've done and the information you've collected, you've kind of now moved that one step further. So we have these archetypes and we have these environmental situations that are very common to most people that we can link issues in the mouth and in the teeth to. When somebody comes to see you, what typically happens in a conventional dental office setting is they have to go back time and time again. You're put on a frequent recall system where you go back and you have things reassessed, and maybe that results in dental treatment, maybe not. How does it work when somebody is working with you? What does that look like as far as, how much of an ongoing process is the coaching that somebody has with you when they start working with you?
I encourage people to work with me for a few sessions, maybe up to a year. Few people have wanted to work with me for longer, though our focus after the first few months tends to not be so tightly focused on the mouth, but more on the wider picture of their life, because everything in the mouth is connected to everything in your life. I end up supporting people as a kind of a professional coach or a relationship coach, or not that I would claim expertise in any of those things, but just I'm kind of occupying the space in their life that they might give to a therapist. I'm someone to talk to explore questions with, to hold space for people to figure things out. So that's the nature of the ongoing relationship. But really, I try and give people what they need to be able to heal their mouths and find a more kind of peaceful and confident relationship with their dentist within about 6 hours or so. Yeah. A little bit longer sometimes if it's really chronic conditions.
So it's really...
Sometimes I'll just see people for like 30 minutes or an hour, and what we're doing there is just answering a specific question. They might want just advice about, should I get this root canal, or, how can I fine tune this aspect of my self-care practice? But if we're going to do this deep metaphysical work, I really like to do that over a series of sessions. But I don't want to have a business model that relies on people never feeling fixed. I want a business model where people come out of it feeling really confident and able to take care of their mouths themselves for the rest of their lives without needing me to hold their hand.
Right. Really helping them to develop a level of self-responsibility where ultimately, if you do the things that you're hoping to do with them and for them, they eventually don't need you. They can take the responsibility on for themselves and move forward in a way where they really don't need an external source of, either validation or guidance or an expert to tell them what to do, what not to do. It sounds like that's sort of the model that you're working within and that you work with your clients in.
Yeah. Though that said, I'm just thinking about how I'm learning all the time. So people who I did work with 3 or 4 years ago, I didn't have the language of the archetypes then. And having the language of the archetypes that I've developed now, the concepts that I had without the language were like really nascent and not as well defined and not as easy to pick up and explain and use. Now, if someone comes and works with me, I'm able to, I think work more efficiently isn't the right kind of word, but, in a more articulate and directed way. And so, if I was to have someone come back who I saw 3 or 4 or 5 years ago and work with me now, it would almost be like I was adding, completely new information because I've learned so much in the meantime. And I hope that I continue to learn and grow in this area for the rest of my life. I would hate to be so stagnant that I could not have something new to offer someone 5 years from now or 10 years from now.
Yeah, I think when you're working in these realms, when you're working with understanding the energies that are prevalent throughout our existence, throughout our body, that sort of comes along with that territory where you do constantly learn and open up and grow your level of awareness. And I agree, the things that I know now, and I'm still learning, but the things that I know now, I didn't necessarily know 5 or 6 years ago, or didn't necessarily have the understanding or language for. And that's one of the really beautiful things in opening yourself up to understanding the metaphysical aspects of our reality, because it does lend to a whole new understanding of how not only your body, but how life and how reality as we experience it works. And so I think your work, because it is so based in energy, ultimately the energy that affects the body, you are kind of in that space where you're always flowing through the information that's being given to you through the field of not only the body, but also, universal intelligence. And I would say that you have a lot of information in your book relating to teeth. And what I would like to ask you or touch on is there an overlap between the information that you've come across and the paradigms that you work from and say perhaps the TCM model of the energetic meridians that work through the body and work through the teeth?
Oh, absolutely. So I think the traditional Chinese medicine meridian system is the best known of the metaphysical frameworks of mapping meaning onto the mouth. I have done a lot of research and a lot of thinking about what most people call teeth meridians and I call mouth meridians, because they're not actually in the teeth. They're in the gums and the jaw, and we identify them by the adjacent teeth. But turned out that it's not as ancient a part of traditional Chinese medicine as we've been led to think, because the association of meridians with particular teeth was only really found in the 1960s. And of course, traditional Chinese medicine goes back thousands of years. It's probably one of the oldest known systems of healing and understanding the body that is still practiced today. And so there's a lot that we can learn and apply from healing methods based on TCM, like acupuncture and reflexology and even EFT, that's really useful for the teeth. I see it as a sort of, I describe meridians as kind of a mystical landscape of the mouth, and that it is not always logical when you look at a dental chart and then you look at a meridian chart. It's kind of like looking at Stonehenge, and when you get the photo with the city and then the highway in the background instead of just the green field. It's like it's a mismatch, but yet they coexist. But one is really older and has this mystical meaning that doesn't necessarily inform the day-to-day way we relate to our mouths. And so one of the things I wanted to do with the archetypes is take that mystical meaning of the meridians and incorporate it into this archetype system where it would be kind of more accessible and user-friendly to those of us who are living in modern, urban, internet-informed society. Something we can grasp onto. Yeah.
What does that look like from a practical sense for maybe somebody who's slightly familiar with the traditional Chinese model of the meridian system? How do you sort of link or mesh the archetype system that you've developed with that? Like, how would you bring those two things together so that somebody could understand, for example, the coherence between how the meridian system can actually inform a particular archetype within somebody's life?
Yeah. So each meridian in traditional Chinese medicine is associated with sort of a range of emotions. So the kidney and bladder, for example, which are associated with the four central and lateral incisors, top and bottom. And those are often associated with negative feelings of shame and humiliation and self-consciousness and shyness. And if you think about the way that we learn as children about how to fit into culture and society that we're raised in, so much of that is about like toilet training and about like overcoming the shyness of being like totally wrapped up in your primary caregiver and relating to people in further out from that intimate relationship. Those are developmental stages as a baby and a toddler that involve similar emotions to the ones that are represented or associated with those meridians. Does that make sense? It's a hard thing to explain because of this mismatch between the mystical and the modern.
I can imagine it's probably, bringing these things together is sometimes difficult with words because you can only really explain and understand so much. A lot of this is probably, with your work and with your experience, I would imagine there's some intuition or intuitive sense to what's going on with somebody that you're communicating with in a consult.
I think intuition's a big part of it. My intuition and their intuition and the interaction and collaboration between us, but also the importance of somatic work so that you're not reliant just on language to describe or explain or interpret emotions, but that you focus on the felt sensation of emotions. So that's a lot of what I do in my sessions is not talking. We talk about it a lot, but as well as talking about, I'll get them to feel it. Like, where do you feel that emotion in your body? So we'll be starting from the tooth. That tooth has a feeling. Then you focus on the feeling. Then the feeling might be in your gut or your chest or your throat or your hips. Feel that feeling and really kind of give that feeling space. And that feeling then is able to be released simply by having your attention, your somatic awareness and patience to stay with often an uncomfortable feeling. That's my role in the process, is to hold space and enable someone to stay with an uncomfortable feeling until it transforms or dissipates, is released somehow.
Yeah, this is so interesting to me, actually, because this has come up a couple of times for me in the last few weeks, this idea of allowing your body to feel its feelings. And that sounds so simple and almost like something that we don't even need to think about. Like, that's how simple it sounds. But I think because we train ourselves out of the ability to feel our feelings, like somebody that I was speaking with in another interview used this example, and it just really hit home for me. It was the idea of just feeling what it feels like to need to go to the bathroom. And that sounds like a really simple thing, but we have been programmed, most of us, for most of our life to shut down that feeling of needing to go to the bathroom. So if you're in school or if you're at work or if you're in a meeting, you almost suppress that need that your body is messaging you about. And rather than suppressing that, and, it always ends in something painful and uncomfortable and needing to hurriedly rush to use the facilities. But if we let go of all of that, let go of that programming that we should shut that feeling down, and we instead really felt the feeling of, I need to go to the bathroom, and then go to the bathroom, use it, and feel the feeling of how good it feels to no longer need that. Just recognizing those things within your body is a whole different awareness of the signals that your body is sending you than to suppress those signals, hurriedly go to the bathroom, come back really quickly because you don't want anyone to know you were gone too long, or you don't want somebody to think that you were being disrespectful or weren't paying attention, or whatever story you tell yourself. And really disregarding that whole orchestrated system inside of you that is designed to give you a message. And it sounds like what you're describing and what you work with is something that's, in a similar vein, but that shows up maybe as a toothache rather than I need to go to the bathroom, or, it's hurting that I need to go to the bathroom. You deal with people who've been suppressing or ignoring or really neglecting certain areas of their body's messaging system, and now it's showing up in the teeth. Would that sort of be a fair assessment of what you're doing?
And it doesn't even have to reach the point of toothache. I often speak to people who will describe, almost like they're embarrassed to describe. It feels like there's a sensation of fullness or pressure, or there's almost like a vibration in my tooth, or I can't even describe it. It's just a feeling, the feeling that I'm aware of the tooth, this awareness of a particular tooth. I think that's a precursor to, if you ignore that feeling, then it will develop into symptoms that would be recognized and diagnosed by a dentist. But they take that feeling of, oh, there's some awareness, discomfort, whatever, to the dentist, and there's nothing to see because nothing is physically wrong yet. What it is the avatar or the emotional issue, the psyche speaking through this language of the teeth, what I call archetypes, to draw your attention to what needs to be expressed, acknowledged, released, changed, or just to be aware and trusting your own felt sense, your own intuition. Because what is intuition if it's not what your felt sense of the word tells you? I mean, sometimes intuition comes through as thoughts, but more often it's not thoughts. It's something that's outside of language. It's a sense. When you're really tuned in and open to feeling those undiagnosable awareness of sensations or just a calling from inside your mouth. And then you can translate that by a mapping system like the archetypes or the meridians. And then you can then respond. Often that's just all the psyche needs, is for you to be aware and respond. And then you don't have to get a cavity or develop gum recession or whatever. It's just like the resolution is so available with attention.
So do you believe then it sounds like you believe that when it's appropriate and when it makes sense, there are situations where working with a dentist and undergoing relevant dental treatment is sometimes still necessary, but it's a matter of finding out, what is necessary, what is relevant, what makes sense for the person, rather than just doing what they've been told.
Yes, absolutely. I think that most of the time when things don't turn out well at the dentist, it's because the patient has kind of given up their power and their curiosity and their self-responsibility and submitted themselves. There's something really intrinsic to the whole posture of being a dental patient. You lie back in that chair, your belly up, your mouth open. Someone invades your body. It's really very intimate procedure. They take sharp tools to you. They cause you pain, and then they take your money. It's no wonder dentists are sort of a popular culture figures of sadism and so on, because there's so many parallels to the powerlessness involved. So I really want people to be able to kind of completely shift the way they feel about that situation and have a really positive and constructive relationship in order to have necessary dental procedures. Because the thing is there's a lot that can go wrong in the mouth that, if it is left for long enough, cannot be reversed naturally, or not in time to avoid a great deal of risk. I would always try and err on the side of caution. I mean, I'm not a dental professional, and so I'm always going to err on the side of caution because I don't want to take risks with other people's health. Also, I'm not seeing people face to face. I'm working online with people in other countries, and my duty of care is to make sure that they're getting the care that they need. But I do encourage people to treat a dentist initially as a diagnostician rather than taking for granted their recommendations, like to get information, go find out what the dentist sees, what they think, look at the x-rays with them, get the x-rays, bring them to me. We look at them together. I teach people how to read x-rays for themselves so they can see what the dentists are interpreting. And we talk about all the different possible ways of approaching a particular dental problem and the pros and cons and how that fits into someone's own sense of what's important for them. And then they can go back to the dentist and say, I want you to do this and I don't want you to do that. I need to know more information about what materials you're using or whatever before I can make a decision. You know, they're being empowered. They're not just submitting to whatever procedure without understanding it. I've found that when people do the metaphysical work, so they're understanding and engaging with the messages that are coming through in their symptoms, they're working with the themes and questions of the archetype, then whatever procedure is done to that tooth is likely to be so much easier without complications, and to be the end of the story. Like, they don't need repeats and ongoing treatment. It's like it can be really resolved. So you might end up getting a root canal or a filling or an extraction or a crown or whatever the thing is that tooth physically needs. But then that is able to stay stable and strong and healthy and be well tolerated by the body and comfortable, and it's the end of the line in terms of that tooth needing support, because you've met the underlying energetic need that was being expressed through the symptom. Then addressing the physical symptom is like the icing on the cake isn't the right word, but it's the part of the bigger picture of the energetic work that's actually resolved the cause. I don't like to use the word cause. I talk about influence, because I think there's usually multiple causes, some of which are physical and some of which are metaphysical.
Right. And to what you just said, are you familiar with the Bigglesons? With Josh and Adam Biggleson? Their father was Harvey Biggleson? No? Okay. Well, Harvey Biggleson was a medical doctor in the U.S., and he was actually an eye surgeon. And then over the years, he moved out of surgery and he founded the American Homeopathic Society, and just a lot of work in the natural health world. And he actually worked with a lot of biological dentists as well. But what he said, just speaking to what you just said, is that although there are lots of things that can be traumatizing in medicine and dentistry, including some of the materials that we use, what is more damaging to somebody than, for example, an amalgam filling and the potential toxins in an amalgam filling are what are the emotional, energetic, underlying issues that led that person to need that filling in the first place. Because if you don't address, acknowledge, and work those issues away, and you blame the material, although there may be issues there, you haven't really foundationally addressed the problems that got you into a situation where you would be at your dentist's office, where you would be lying back in that very vulnerable position, where you would need the filling. And so it's not necessarily the filling or the material or the dentist, although all of those things contribute. It is, just as you were saying, what are these underlying root influences, as you would put it, that have led somebody to a place where the dental work is even necessary, regardless of what it is?
100%. Yeah, that's absolutely the way that I think about it. There's no sort of blanket answer to the question, should I have this root canal or should I have this root canal removed? Should I remove my amalgam fillings? Well, look at the issues related to that tooth. The archetype is like a shorthand way to understand those issues, and that helps you to assess whether it's just a physical vulnerability or whether this underlying energetic influence can be resolved, and then the physical vulnerability is mitigated.
And for myself as a practitioner, so, I deal with patients all the time, and I will say just the emotions that people carry with them into a dental appointment, they really do affect the outcome of that treatment. So, in a very simplistic way, somebody who comes into the office and is confident in the procedure not being a big deal, and that, they're going to be in and out and it's going to go well and they're going to get on with their day and their life. Those patients, those people tend to experience that because, that's the paradigm that they come into the appointment with, is that it's no big deal and, life will go on and life will be great. The people that come into an appointment are incredibly nervous, are anxious, maybe feel apprehension about the appointment, don't know if it's going to go well, are carrying a lot of the emotions related to maybe past trauma in a dental chair with them. Those are the patients that tend to come back more regularly or have more complications related to treatment. And so I think, even though this is a simplistic way of thinking about this, it does speak to the energy, the quality of the energy that you're bringing with you into treatment, and that energetic pulse that you're walking into and out of a treatment with. It does influence how you heal and how you experience the aftermath or the after effects of whatever was done in the chair. Because, as you said, it is incredibly intimate. And I have always thought that experience of having a patient in your chair and the level of trust that is imbued in you as a practitioner, as a dentist, to have in some cases, patients that you don't necessarily know very well. You've maybe only met them a few times. And they are trusting you in this very vulnerable position where, they are laying back, they are frozen, they can't feel what you're necessarily doing to them, and they can't see what you're doing to them, and you are very much in their space. It's all very intense, or it can be very intense. And so there is I would say a level of responsibility that the dentist holds for holding this space where people feel like they can trust you, but also where overall the vibe or the vibration of everybody involved in that, and that goes from the person themselves, the patient, all the way to the team, the whole office. It's important to carry a feeling or a sense that what is happening in that appointment and the way you look at that patient is from a holistic view. Like, you're looking at this person as though they're a whole person, not just a molar that you're fixing that day.
Yeah. And that, you're right. It's so important, and everyone involved has a responsibility. The dentist, the patient, everyone in the team. That's why I wrote my book. My second book's called Calm and Confident in the Dental Chair, and it's to help adults overcome dental anxiety and be able to have this more empowered experience at the dentist and have easy experiences in the dental chair and uncomplicated outcomes. As much as they're able to influence it, they should be doing that. It's not 100% of the experience, but it's probably more than 50%. So, yeah. One of the things I say to people is that whether or not a dentist is calling themselves holistic or biological or functional or any of the other terms for sort of alternative dentistry that might indicate they share similar values to you around health, that it's more important to find a dentist who will create that space, who will listen to you with respect, who will answer your questions, really listen to you, who will respect your boundaries, who will treat you like a human being and an equal. That's actually more important than whether someone, is anti-root canal or will, prescribe vitamin C for gum disease. Like, those those kind of things, you can negotiate with a dentist, the particularities of a holistic treatment. You can negotiate with a dentist who treats you with respect. So that's like the bottom line, which I think is really important because a lot of people just don't have access to like a real choice of dentists. There's so few dentists who do operate in this alternative kind of paradigm, but there's a lot of dentists who are decent human beings who are able to listen and treat you with respect and kindness. And that is a really good starting point. If you go in from an empowered place, if it's really important that you need a particular kind of restoration material because of sensitivities or intolerances or that, if you go in and you're able to articulate that in a constructive way with a dentist who's able to listen, then you guys can figure out a way to get your needs met as a patient. Then go and see someone else. See if they're a decent human. That's a good starting point.
I agree. That's so important because I think now in this time that we're in, there's a lot more awareness around natural or holistic or alternative ways of approaching health and medicine. And oftentimes people can get really caught up on the labels that we give to professionals and people in the health space, and to just go back to basics and do exactly what you've just suggested. If you don't have access to somebody who is quote unquote holistic or biological or, has one of these labels that they've titled themselves with, if you can just approach a practitioner to see if they are a good human, to see if they are capable of listening to you and understanding your concerns and doing the best that they can to address those concerns, because at the end of the day, every dentist is just a human being. And, we're not magicians. We can't necessarily work wonders. I think the thing that every dentist who wants to do good things and be a good person can do is they can do their best. And if you approach it from that place, I think that takes a lot of it takes a lot of the stress out of feeling like you need to find somebody who has this title or this label. But two, it brings some connection back and like a sense of relationship in literally the relationship that you build with your dentist, so that it's not this one-sided flow of communication where your dentist is telling you things and you have to do what they tell you. But there's more of an exchange where they, from their perspective, are giving you what they know about your dental health and what they can see in regard to your dental health. But especially when you walked in there in a state of embodiment and have some empowerment around your health and the messages that are coming from your body, you can have a dialogue with them and really have an exchange with them that allows you to feel like you're coming to a place that allows you to express your highest level of health. And that's kind of, I think, the goal for most people at the end of the day, is to feel like they are a part of creating health for themselves. Would you say that the people that you're dealing with are typically very open to and willing to take a lot of self-responsibility for their health and the conditions that have maybe brought them to a place of dis-ease or dysregulation within their health?
Yeah, I think by the time someone, makes the effort and invests the money and puts themselves into all the awkwardness of a Zoom call and all of that, then they do tend to be someone who's quite self-responsible and proactive. But I think my approach is confronting for a lot of people. I know a lot of people that are just like, this is not their thing, and that's fine. I'm not trying to like convert anyone to another way of thinking or, say that I've got all the answers. But I think for people who do really apply that principle of proactive self-care and self-responsibility and a desire to understand the bigger picture behind their health, and they're used to applying that in the rest of their body, applying it to their gut issues or their skin issues or whatever, the next step of applying it in their mouth, it makes a lot of sense. And they may not have known they were looking for someone who could help them apply that to their mouth, but then they come across me in whatever way, listening to a podcast or finding me on the internet, and it's like, oh, this is what I needed to really go the whole body,
right?
Not leaving the mouth out, not keeping it separate.
Yeah, you mentioned this a little earlier, and it's absolutely true in my experience, is the mouth is like this, so to speak, black hole separate from the rest of the body for some reason. And even people who are very much capable and willing to take control of all of these other aspects of their health, they're maybe going to the gym regularly or working out regularly, yoga practice regularly, really on top of their microbiome and their gut health, and will engage in mindfulness practices. So we have people that are very capable and willing to do all of these things, but for some reason, the mouth is like this separate entity that doesn't get that same kind of very intentional attention from them. And it's so interesting to me because as far as the gut goes, and I mean, now gut health is almost like this trend or this fad, but the mouth is the first part of your gut. It's the first part of your digestive tract. And it feels like there is this very big disconnect that hopefully, conversations like this and people doing work that you're doing like you are helping to close that gap. But do you have any sense of why that disconnect is there from all of the conversations you've had?
Yes, I think I've got a few theories. One of them is if you look at sort of the history of dentistry and how the first dental school was excluded from medical schools, the first medical schools kind of a couple hundred years ago, there was a very deliberate sort of a snobbery from medicine towards dentistry. Prior to modern dentistry, people got their teeth pulled by barbers, and, there wasn't august history of dental care in the way there had been medicine, through from the Greeks and the ancient Ayurvedic and Chinese traditions. But somehow dentistry was always a little bit separate, certainly in the Western canon. So, and then things like toothpaste and so on are treated as cosmetics rather than as therapeutic medicines, in the FDA organizing of things we put in or on our bodies. There's this idea that the mouth is just this superficial cosmetic thing. It's how teeth look matters more than how they function. And then the sort of development of orthodontic treatments as a growth industry, and then the explosion of that into the adult orthodontics and aligners and so on, and it's so commercialized, like the way that it's funded. All of these structural aspects have meant that the mouth is considered separately. So then you've got this sort of the alternative health world, which is alternative, but it's kind of a mirror image of mainstream health. It's not really alternative in being like integrated with oral health and whole body health. It still parallels this separation. I met very few alternative health practitioners in any discipline who, and I always ask them, like, when you were studying, how much time did you spend on teeth or gums or anything to do with the mouth? And at best, it will have been a couple of lectures, maybe a week out of a 3-year degree. Like just so little and so superficial and trivial, and often just treating it as a cosmetic issue. And so there's no wonder that that's we as individuals feel and think, because there's nothing in the wider culture that shows us this integration, which is, it's so preposterous when you think about it. I mean, the mouth sits here. It's in the physical body. It's so close to the brain. A third of the nervous system receptors in the brain link to the teeth and gums and jaw. And yet we just treat it like it's not connected to the brain and it's not connected to the body. It's like this floating, like the Cheshire Cat grin, floating in Alice in Wonderland, disconnected from anything. In fact, that's a really good symbol for how it works. Yeah, this delusion of separateness.
So, Meliors, for anyone listening right now who wants to feel empowered about walking into their next dental visit and wants to feel as though they can trust themselves and really evaluate whatever information they're getting from their dentist or their hygienist in a way that feels like it's in alignment for them, what advice would you give?
I think one of the best things you can do is actually have a look at your own teeth. You can get a little mirror and look at your teeth yourself and get a sense of your own perception. And then when you go to the dentist, you're not blindly trusting them because you've seen for yourself. And often a dentist will offer to show you what's going on in your mouth. They'll take intraoral photographs, or you can, they'll talk through the x-rays with you. Take advantage of those opportunities to understand more about the visual information of your mouth. And that helps you to map it as well. So remember or write down which teeth, the ones to keep an eye on or that need a treatment or have had treatment in the past. And then you can look up a mapping system like my own Tooth Archetypes or the Meridian system or one of the other ones and start to explore this exciting, interesting world of metaphysical influences. It's a very empowering thing to engage with.
And just out of curiosity, have you had a lot of dental professionals come to you to learn about the archetype system that you've developed or read your book? Is that something that you've connected with other dentists or dental healthcare professionals on?
There's a few. I wouldn't say there's a lot. I would love there to be more. I'm so thrilled to have you make touch with me because, yeah, this is definitely, I think, a really important thing for dentists to have in their toolkit of ways to be able to support their patients. If a patient says to you, why is this happening to me? Why is this tooth not getting better, or any of the other why questions, and the standard answers about inadequate oral hygiene or diet just aren't sufficient explanation, it can be really reassuring for a patient to have the idea that there may be whole life influences, like contextual, emotional, social influences on why something goes wrong with the teeth. So even if as a dentist you're just saying, well, have you been really stressed lately? Because that can make your teeth more vulnerable. And if you're looking for a scientific explanation because that's your way of thinking and communicating, it does. Stress affects the oral microbiome. It affects dental flow. It certainly affects the tension in the jaw and the bite and the grinding and clenching and all of that. And stress is an emotional issue, and it's a response to social circumstances. And so you can have that conversation with a patient that can be really reassuring and build trust with a patient. And I would be so delighted that if at any point in my long, difficult dental life, I had talked to a dentist who suggested that there might be more going on than me not flossing enough when I was the best flosser I knew, I think it would be great for dentists to adopt this as part of their repertoire.
Yeah, I agree. As a dentist and as someone who has read your book, I really appreciate the patterns that you've seen across all of the people that you've worked with, and the ability that you have to condense this and make this really understandable for anyone, but particularly for dentists where we're interacting with, it could be thousands of patients a year. And if you have the ability to impact how people see their mouths and see their teeth and really start to connect the dots, literally connect their teeth with the rest of their body, I think this is part of that paradigm shift where we bring the mouth back into the body as a part of who we are and how we function. And I just want to thank you for your work in this space. And you've really taught me a lot. Reading your book taught me a lot. And so whoever can pick up your book and is inclined to read it and learn from it, I think that there are certainly ideas in it that could change anyone's mind around the beliefs they hold with their teeth.
Thank you so much. I appreciate that.
Yeah, you're very welcome. I just want to thank you so much for joining me today. And we will put a link to your website and your book in the show notes of today's episode. Is there anything else that you would like to say as we close off today?
I just would love to let people know that I'm embarking on a lecture series on the Insight Timer app where I'm doing an in-depth deep dive into each tooth archetype. So 32 teeth. I'm going to talk in much more detail than I was able to put in the book, which I wrote nearly 3 years ago. All my new learnings, examples from people's lives and so on, and a guided meditation to sort of engage with each tooth archetype. So if you're interested in that, find me, Holistic Tooth Fairy, on the Insight Timer meditation app.
Perfect. Thank you so much. And thanks for all the work that you've done in this space. And this was so fascinating. Such a fun conversation.
Thank you. Great. I've enjoyed it too.